Very good afternoon. Let me just begin by making a quick remark before I introduce our panel for today. As somebody that has, for the last 25 years, been trying to grow the awareness of psychology in Malaysia, I can tell you that being an event like this fills my heart with a certain joy and excitement, right? Because when I see the interest level in behavioral insight, which is birthed from the area of psychology, right, and cognitive science, I think it's so important what you're doing. So I just wanted to start with an encouragement for all of you. I understand that many of you represent different government departments or different private organizations. I think this is absolutely the direction we need to head in as a country. Because look, the basis of any good public policy is an accurate scientific understanding of human beings, right? For any public policy to be effective, an accurate scientific understanding of human beings. So let me just start off with that encouragement for all of you, right? Now, today's panel session, we're going to be hearing from three illustrious speakers who have one thing special in common, which is that all three of them have experience in implementing and applying behavioral insights to different projects in Malaysia, all right? So I'm going to be introducing them one by one, and they will then have a few minutes to present the case studies. And at the end of all three speakers, I will then allocate a few minutes of question and answer, all right? So let's get started. Our first speaker, all right, is the Deputy Director for Kuala Lumpur City Hall, DBKL. It is Engineer Rusnida Talib. Please join me in welcoming her to give her presentation.
Okay, Bismillahirrahmanirrahim. Good afternoon, ladies and gentlemen. I'm truly grateful to be here to share on the findings of our BI case studies. Thanks to MPC for inviting us here. My name is Engineer Rusnida Talib, Deputy Director of Civil Engineering and Drainage Department, Kuala Lumpur City Hall. Okay. Enhancing road digging practices in Kuala Lumpur, a BI approach. Let us start with this photo. Okay. Concentrate on the middle one, the colorful cartoon. So, looks familiar, right? Because it was viral in the social media. Okay? I must admit that whoever created this, he or she must be very observant and very creative, you know? However, I already covered the names there because I'm not that rich to be sued by the companies who appear on the trucks and the heads there. Okay, but that's the reality. That is what's happening in all Malaysia, not only in Kuala Lumpur. It is sad, actually, but it's quite true. So let's move on with the impact of it, of the photos. The grey color photos, left and right. So that's the impact of the road digging in Malaysia. What they did, they covered, and yeah, I purposely do it in grey so that you can really notice where is it actually, okay? Okay, the issue that we have in Kuala Lumpur, next please. Okay. The non-stop road digging by the utilities companies. One after another, there are a lot of developments in the area. So it's a non-stop situation actually in Kuala Lumpur. And it causes inconveniences and potential danger, not only to the people, not only to the road user, but only to the workers at the site too. So by using Prime, let's us go to the next slide. Okay, the purpose of the BI is we want to study why this contractor, they cannot do their works properly. They cannot follow our regulations. Why they behave like that? So that's what we do, the purpose of this BI study. And next, so despite our various checklists, we have a lot of forms, we have a specification, we have guidelines and everything we publish in our website, but still some of the contractors didn't follow or didn't meet our requirements. Some perhaps maybe asal boleh, asal buat, or asal tampal. So that's why then we did a workshop. Next, please. Okay. We did a workshop where we call upon our stakeholders, and we continue with 2 sessions of the focus group discussion with MPC and our utility contractors only. And these are the findings that are shown here. Number 1 is lack of awareness of the SOP, bias issue, lack of awareness from the public, and time and logistic constraint while they are doing their works. By using intervention, okay, next. Okay. We produce a poster. So as you can see that from a lazy to read SOP with more than 5 pages and all black Arial fonts, we turn it to a colorful poster. Okay. So I think this is more engaging to read, right? Rather than black and white paper. So as for the public, our intervention will be, next please. We acknowledge their sengsara. So we ask the contractor to provide a signboard. Normally you can see that kesulitan masa kini adalah untuk kesenangan masa hadapan. That's always what you see in the construction area, right? So we ask them to put some of the promises. You have to promise when you are going to complete your works, so that the public, while they're driving, they know, okay, oh, this job is going to stop or to complete by so and so. And I think we do understand that there are some people out there who need essential services. I mean, deep down, we understood, okay, you have to do your works, although I'm not so convenient while driving in this road. But we understand that they need essential services, they need the clean water, they need the uninterrupted internet line or water supply, right? But we need them to do the works properly. Make sure the roads pavely, smooth, and etc. Okay, then we go to the M, which is measure. So we are doing the intervention and measure by 2 tests. The randomized control trial, RCT, and A and B testing, that is after and before. So the poster just now, we distributed to our client, not our client, our permit holder, which is TNB. We concentrate on the TNB first. And we hope that, next slide please. We hope that by distributing the interactive, colorful poster, the awareness will be increased and the numbers of compound that we issue to them will be reduced. Okay, last but not least, we are targeting to expand this study to disseminate to all the utilities that we have in Kuala Lumpur. And we want to measure the same variables as same as TNB. And with that, thank you very much for your attention.
Now, again, just a reminder that I'm going to get all of our 3 panelists to speak first, and then after that, we will set aside some time for question and answers. Now, our second panel speaker is a consultant attached with the World Health Organization. As you know, the WHO does a lot of projects with our Ministry of Health here. So please join me in welcoming Ms. Liyann Ooi.
Thank you and good afternoon. Well, firstly, I want to thank MPC for having me today. And I'll just get right into it because I apparently only have 6 minutes to speak. So time pressure is not great for my psychology, actually. Okay, Can I have my next slide, please? So I'd like to start with 3 facts to set the scene for my presentation. These are not really great facts, by the way. The first fact is to say that NCDs are the leading cause of death in Malaysia. I'm sure all of us here know someone who either has diabetes, cancer, heart disease, or maybe we've even lost someone to that, right? And it's increasingly prevalent even among the younger people. So NCD is getting worse, not good for us. The second fact, and this links to the theme of productivity of today's conference, is to say that Malaysia incurred 51.8 billion in productivity losses in 2021. So NCDs is not good for our economy. And third and finally, we have a lot of work to do, right? Because virtually almost every one of us here have at least one risk factor for NCDs. And because in Malaysia, we like to talk about food, right? Today, I'll be talking about diet, okay? So we all know that healthy diet is very important to our health and well-being, but actually making healthy food choices can be quite challenging in the midst of competing information, all these marketing tactics, and choice overload, having so many choices, right, when you go to the supermarket or the restaurant. So it is really so complex to the extent that I'd like to engage you in this very brief interactive exercise to illustrate this, okay? Can I have my next slide, please? Thank you. So imagine you are at a supermarket now, okay? And you want to buy a box of cereal. Research suggests that it takes between 8 to 15 seconds for people to make a decision of the product to buy. So you see this box of cereal, and this box of cereal has 2 labels on it. It has a blue label in the front and a black and white label on the side. The question is, which label are you more likely to notice? The blue label or the black and white label? Oh, wow, okay. No right and wrong answer, lah. Just trying to gauge. Okay, great. We'll move on to my next slide, please. So then after that, you see another box of cereal next to it, lah, because we like to compare options, kan? So you see another box of cereal next to it, and this box of cereal has this colorful label that says Nutri-Grade A to D. Okay, the question now is, which label helps you decide which product is healthier? Colorful one or the blue one? Colorful one. I hear a lot of colorful ones. Okay, great. So you all did that in 8 seconds, which is great, which is what research indicates. I'll have my next slide, please. Thank you. Okay. The exercise that we just did basically illustrates how the placement and design of labels can influence how we make decisions. Simply put, where and what information we provide influences how we make decisions. Where and what influences how we make decisions. Okay, so I'll make a couple of points from this slide. We'll move from left to right. The first point I'd like to make is in this green box here. So evidence suggests, and behavioral insights suggest, that front of pack labeling, putting your labels in front, actually increases the salience of nutritional information compared to having the labels on the side or in the back. And that's why WHO also recommends front of pack labeling as one of the best buy measures to encourage healthier eating purchases and thereafter help prevent NCDs. So that's about the where, right? And a lot of you also identified that you'll first notice the label on the front. So that's about where labels should be placed to actually attract attention. Now we talk about the what. So move on into this blue label here. Let's talk about the what. And basically, from a behavioral insights perspective, informative labeling, such as the reference intakes that are used in Europe, which is these blue labels that has a lot of numbers and figures on it, provides detailed information, but it increases cognitive load. Imagine trying to understand what this label means when you are at the supermarket, shopping with your children, at the end of the workday, and rushing to go home and prepare dinner, right? It's so hard to understand, is this product healthy or not for me? And therefore, it makes it hard to make decisions just by providing information, just by being informative. And therefore, evidence actually suggests that interpretative labels work better or are more useful to consumers to make decisions. So there are a number of interpretative labels out there, but today I'd just like to point out 3. The first one is endorsement logos. And an example is the Malaysia Healthy Choice logo that we have. They also have something similar in Thailand, and these logos basically tell you at one glance whether or not this product is healthy. Okay? They tell you at one glance whether or not this product is healthy, but the problem is, it doesn't tell you whether a product is unhealthy. So if a product doesn't have this label, does it mean it's unhealthy, or does it mean this product was just not part of the labeling scheme? So there's a bit of ambiguity there. In Chile then, in Chile, the country, they started introducing warning labels in 2016, where they would put labels about products that have a high content of undesirable nutrients. So for instance, high in sodium, high in trans fat, or high in sugar. So at one glance, you know that this product is high in sugar or high in sodium. And that kind of addresses the ambiguity with healthy choice logos. But Singapore took it one step further, and Singapore has introduced this concept called the NutriGrade. They've introduced it since 2022 on prepackaged beverages. And basically what this NutriGrade does is it provides you an overall assessment of the nutritional quality of that product on a grade from A to D, right? And that allows you to also compare between products. Remember when you have like 2 bottles of cereal, you want to know whether the one with a label A or a label D is healthier, right? So this sort of label actually helps you to compare between products. So in summary, interpretative labeling uses simplified cues that creates mental shortcuts. For instance, green is good, red is bad, D is bad, A is good. Even in Chile, right, they are teaching kids that, you know, if you see a product that has like lots of octagons in it, don't go for it, it's not good. And the kids are also telling their parents that when they go shopping together. So these mental shortcuts actually helps people to make more informed decisions then. I have my next slide, please. Before I end, I'd just like to make one more comment. So many of you here may have children or nieces and nephews, and you want them to grow up healthy. And as the awareness and demand for health increases, evidence indicates that front-of-pack labeling can actually prompt reformulation of products. Therefore, diversifying the product range and widening your product range can continue to meet consumer demands and consumer needs. And in fact, this could also potentially help you increase exports as you meet the international nutrition standards as well. Ultimately, if people stay healthy longer, they consume more, they consume longer, and this is good for our economy. So to conclude, I'd just like to say, and during the opening remarks, YB Senator mentioned that behavioral science is really a science, is an art and a science, right? I like to add that we need to stop, or rather we need to reframe our question from asking, what's the matter with you? Like, why aren't you eating healthier? Why aren't you paying your taxes? Why aren't you saving more money? We need to start reframing that from asking, what's the matter with you, to what matters to you? And having more empathy in how we design our solutions and interventions. Thank you.
Really interesting, some food for thought, right? Our final panel speaker is a nutritionist in the Ministry of Health Malaysia. Please join me in welcoming Ms. Teh Wai Siew.
Thank you, Dr. Goh, and good afternoon, everyone. Today, I would like to share with you regarding our journey about informing the healthy food choices. Thank you for Ms. Liyann, because she did a very good work and helped me do a lot of the introduction, so we can further to see if we want really to propose this kind of policy into our public, how the public will respond. Okay. Next, please. All right. So before I continue for my presentation, I would like to ask a question. And how many, you and me, or all of us, actually is reading the food label when we do the shopping? Actually, yeah, thank you for your response. Okay. Yeah. From our National Health and Mobility Survey data, we find that actually more than half of our Malaysian adults actually do not reading the food label. They don't have the practice for this one. And then it's become our challenge. We want to empowering the consumer to their knowledge and then to making the healthy food choices. So what we need to do for the reading information panel in the food label, actually is a challenging. So for this initiative is guided by our National Nutrition Policy of Malaysia 2.0 and also from our new plan strategy mengurangkan pengambilan gula dalam kalangan rakyat Malaysia just started this year and will last until 2030. So to compact for our issue, to teach or to educate and create the awareness for the public to reading for the food label, we adopt the behavioral insight in our study that we are using the prime framework that the previous speaker also is mentioned many times regarding the prime framework, which including about the purpose, review, intervention, measure, and expand. Next, please. In our study, we divide into two phases. The phase one actually is a baseline data. We have three main objectives. First, before we design for the policy, we need to understand about how the food label influence the consumer decision. And then next is followed by the factor, how the factor that the consumer will making the choices. All this information will provide to the policymaker and design the impactful intervention. And then in our study, we are using the 50-minute quantitative online survey among Malaysian adults between 18 to 59 years old residing in the Klang Valley. And then they are come from the middle household income group M40. And then the people will ask, why only M40? To the data that we have is actually most of the label is on the food product. And those products is common in our hypermarket, department store, and even some our grocery store. And where is these places the major shopper is come from? M40. Okay. And then one of our criteria as in our respondent is they need to have a purchase or the prepackaged food product in the past 1 week. Next, please. Okay. Our finding, I just highlight the two key points. Our finding shows a very clear significance is about the group of the frequent food label lover, which means they have the frequent to read the label before they do the purchasing. This group of people, they have a significantly positive to make the healthier choices. They are more prioritized about the healthy food choices. They are consciously to select the healthy option. They have the greater concern about the sugar content on the food product. And this slide will show another the interesting point that we find out from this exercise that the older adult, which means it's a 50 to 59 years old, how to motivate to read the food label. Actually, we need to tie up together with the message regarding the health concern. Is, for example, about the diabetes prevention. When they have this kind of the message of the sometimes like the tagline, they are more engaging and motivate them to read about the food label. And however, on the other side, we found about the younger adult. The younger adult, about the health concern, they are not so much interest compared to the older group, but they are more keen and engaged with the wording or to tie up with the text message regarding about the weight management. Which means what we find out here that when we want to develop the promo message or the educational message, we cannot have a one message blanket for all. We need to cater the different messages for the different target group. Next. Okay. So this is another finding that we also would like to see about the preferences of the front of the packaging on the food label. From the study, we found that our public, which means most of the shopper, actually they are not quite prefer about the warning message, which is the dark color one, or the front of pack with a lot of the information. Okay, they are more prefer for the simple type. This is we have same result for the two group, which is the frequent food label reader and also non-frequent food label reader. They like something that is simple, that our current policy is implementing right now, is a healthier choice logo, it's a round shape red in color. And they like this logo is because it's simple, and then it's easy to read and easy to understand. Next slide, please. Okay, so So they would like, even though they prefer for this logo, we also managed to get from the baseline study the information for the area of improvement that the public, beside for this logo, they expect something is a more visual presentation about the sugar content. They want more info, but don't want too much info, okay? Challenging, right? Okay, because of the time consuming. And then they also prefer, if possible, they would like to have some allergen information on the food label. So this is what we're finding that we find from our study. Next slide, please. Okay, based on the finding for the phase 1, our goal in our phase 2 is we would like to design and to motivate our target group that is a non-frequent food label. We want to motivate them to read the label, not only motivate them to read. When they start the reading, we need them to guide them how they want to read about the sugar content, and then they can making the healthier option for them. Okay. And then in terms of the intervention, besides for the healthier choice logo, we will enhance our logo, and then together with the Nutri-Grade that the Miss Liyann shared just now, and then we put a grade to reflect the content or make the quality of the food on the grade of the product. And then by adding this information, they can provide more comprehensive information, and that is a more clearer, and then to help, actually the important is to helping the consumer can making the right choices in the short time. Okay. By leveraging about the behavioral insight, we believe it can help us to transform about the consumer behavior. So in this project, we are not only targeting to increase the number of the Malaysian adult to reading the food label, but it's more that we want to use this opportunity to drive a significant shift towards the healthier option, especially it's a low sugar product option. So then only it can help in line with our mission to improve our public health and reduce all the sugar-related health concerns to our nation. So here is the end of my presentation. Thank you.
So look, you've heard from our 3 panel speakers sharing different ways in which they have actually applied behavioral insight into different fields, right? We started talking about roadworks and the delivery of projects up to standard in DBKL. Our second and third panelists talked a bit more about nutrition and eating. But as all of you know, behavioral insights can be applied to any field, right? We used to joke with my psychology students that wherever there are people, there's a need for behavioral science and insights. All right. So at this stage, I'm going to open up for question and answer. All right. While some of you may have submitted questions through Slido, we want to prioritize those in the hall. So if you have a question, you can see that in the aisles we've got microphones that are there. So please, yes, thank you, sir. Go head over to the closest microphone. All right. And
no, for you.
and please state your question, right? Thank you so much.
All right. Good afternoon, Rohizam from Tourism Productivity Nexus. I do not know how to put tourism in the perspective, maybe not relevant, but I justify under health tourism. All right? Okay. My first question is, do we believe behavioral insight can assist in a short period of time? Or we should ever develop it in the stages. For example, like education on health. Why can't we embed education from school level, from young age? You know, what is cholesterol, what is sugar level, you know, what is the symptoms and others. Reason being is that we have spent billions on medication, on healthcare and others. Because one of the nexus, one of the tourism nexus, productive nexus is healthcare as well as pharmaceutical. Right, Dr. KP? Okay, right. So we did discuss, and somehow or other, we have spent billions on medication, and some of us throw away this medication because they don't see the purpose. Like stroke medication, about 4,000-5,000 ringgit, they just get it and just throw because they only pay a ringgit. So there's no value to it because they don't think they're going to survive anything. But if we can put it from the young age on the behavior of practicing good health, all right, and understanding the level from the young age, you know, for us, anybody 50 years old above, dairy products are no longer good for us. It's not stated. Luckily, I'm younger than that, okay? So, what I can say is, many countries now have actually addressed what is cholesterol, what is diabetic, what is sugar level that is required. Even what we learn, pyramid of food, is it they call it pyramid of food, is no longer relevant. Somehow say it's no longer there, or not being detailed out. So are we trying to solve the problem by just behavioral this way, or we should go on deeper ground so that it will have a long-term effect to the country? All right, that's just my question.
Thank you so much for the question. So perhaps for this, either Ms. Teh or Liyann, would you like to respond? The idea that aside from the interventions you described, whether it is useful to also talk about the education of young people and children. Yeah, Liyann?
Thanks, Rohizam, for the question. And I think it's a great reflection that we need to move from, currently a healthcare system is really a sick care system. We're providing medications, we're treating rather than preventing. So we do need to move from a sick care system to a healthcare system where we're investing more in prevention, in educating the young about promoting good health. To your question about whether we need to do more than just behavioral interventions, so to speak, I like to say that actually the whole suite of behavioral interventions covers a lot. There's the theory of the behavior change wheel that actually maps many different intervention functions, and that includes education, that includes legislation, that includes policy change, includes environmental and structural change. These are all behaviorally informed interventions as well. So education, absolutely, we need to do more education, as well as these more cognitively driven nudges, so to speak. And I'll give you a very brief example, right, and going back to food again. For instance, if, say, you want to encourage people to eat more fruits, say papaya, it would, so providing educational information that papaya is good for you, it's healthy for you, and all of that will not be as effective as, for instance, providing cut papaya in a plastic cup, which you see in the supermarkets nowadays, right? It's so much more convenient, you just grab and go. And these are nudges that go beyond just cognition. These are actually changing the environment in which we present and provide food as well, for instance, and that will apply to other areas of health too.
Thank you.
Okay, I would like to add on to Ms. Liang comment. The first of all, I agree that not currently we are changing the transition, that means from the sick care and then into the preventive. We are looking to the preventive right now. This is the first one. And then the second thing is I totally agree that the education is start from young. But we are not only focused from the young, actually we are cut across all the nation. Every age group we need to target. As like Dr. Goh mentioned very beginning that everywhere got the people, everywhere got the behavior, that we need to identify each stages of the life cycle, and then we need to come in the intervention at the right. Then only can make the system work. This is the one thing. And then the next, I also would like to rectify regarding for the food guide pyramid. Food guide pyramid is still relevant. Food guide pyramid actually is to educate us, to guide us, that means in a one day, how much and what kind of food group that we need to consume. That is for one day consumption. And then it's true that after we, when we go through and review again, and also using the behavioral insight, that we come together with the suku separuh, which is the plate, it's each meal. So which means the education and the awareness, we need to come together with the food guide pyramid and the suku separuh. But this is all about just the very information about the food and then how the portion size. But how about the environment? The environment with the bundle of the food store, the food service, and then also for the food product. So that's why all the labeling and is a come in as a guide, and then we need to inform and to inform the public and then what is the content and how to choose healthier. Okay, thank you.
Thank you. Maybe we've got time for just one more, all right? Sir? Yep.
My name is Victor from Help University. Thank you very much for your presentation on food labels, Liyann and Ms. Teh. But my question is, so a majority of Malaysians, when we eat food, I think about 50% of us here, our breakfast is at the mamak, right? Teh tarik, mamak. There's no labeling in your teh tarik for how much sugar there is in there. So what is your solution to actually, helping us make informed choices when you're going to the mamak and there's no labeling involved? Thank you.
Okay. Again, this is regarding about the system. So it's just a simple, a traditional breakfast. Everybody like our traditional breakfast. The nasi lemak, roti canai is a common food, right? Okay. And then first, we need to educate the public. And then, of course, they need to have a basic and then the knowledge about the nutrition and then the importance about the healthy eating. Okay, this is for cut across all the age group. This is the first thing. Second thing, for the food handler, we need to give the awareness, and then we need to provide the knowledge, and then we only can provide the knowledge because the skill is with them. They are the best cook how to prepare the food. So we provide the knowledge with their skill. They can come out to modify, to improve. So that's why, again, just now about the tourism, about the health tourism, this could be one of the perspectives. That means if you want to promote about the traditional food, we can make it more healthier. And then we can promote our heritage value about all the food in our country. Okay. So, and then another thing now is currently for the restaurant, and then or the warung, we also have the health about the healthy choice, and also a healthy meal. All this kind of program actually is a guide to provide to the public how to choose healthier, and then is what kind of a healthier food that the restaurant or the food service they offer. So all this actually is currently happening. Is also implementing in our current policy right now.
So I think we can look forward to a healthier, more delicious nasi lemak in the future. That can be the Ministry of Health project. Now, maybe just one last question to Engineer Rusnida, all right? I sum up a few of the comments and questions on Slido and I integrate it into, could you perhaps share, Engineer Rusnida, what was one of the biggest challenges you faced implementing your project? And what was your response to that challenge?
Okay, thank you, Dr. Goh. I think the most challenges was some of them feels that it's a social norm. They said that other contractors are doing it, so why can't me? Everywhere also they said the same thing. So they also are not doing according to the spec, why should I? But by the way that we hope that they have some empathy because we are all road users. So whether it's a social norm, whether you are doing it or somebody else are doing it, you are the road user. You are going through the road, so you should feel the same feeling as what other people feels. How we react to the challenges, we try, that's why we apply the BI, right? We want to learn why they behave like that. So, what else they said? We try to, at least, some of them are referring that I'm lazy to read so many things, all your guidelines, I don't have time to read that. So that's why we come up with the simple one, because most of those contractors who are doing the works is not the main contractors. So the information that we pass might not reach them. So that's why we try very hard to get all of them together, not only the main contractors, the utility companies, the subcontractors. At least they have all the information that they're required. They have to follow the specification. They have to follow whatever rules, guides that we provide, so that all the public users can have a smooth driving on the road. Yeah.
And I think that's a nice way to sum up our discussion, because if you notice, the three interventions that were shared, all right, even though they are in different settings. One of the commonalities it had was it focuses on how human beings process information, all right? And in a sense, trying to decrease the time, complexity, to make it simple and fast. So whether it's processing information about the guidelines to finish a road project, or processing nutrition information on a label before they decide to shop, we're talking about a few seconds, right? Reducing from 2 minutes to 10 seconds, but it makes a big difference, okay? So now, please, everybody join me in thanking again our 3 panel speakers for sharing their experience. Thank you very much.